Hi, my name is Mackenzie Lowenstein. I'm a fourth year student at UCLA studying psychobiology. Today, I will be presenting on lingual frenuloplasty with myofunctional therapy, exploring safety and efficacy in 348 cases. My research advisor who made this research possible is Dr. Sarush Zaghi. So, what is ankyloglossia? Ankyloglossia, or tongue tie, is a condition of altered tongue mobility due to the presence of restrictive tissue between the undersurface of the tongue and the floor of the mouth. Potential implications of restricted tongue mobility include mouth breathing, snoring, dental clenching, myofascial tension, and even sleep apnea. In this study, we explore the safety and efficacy of lingual frenuloplasty and myofunctional therapy for the treatment of these conditions in a large and diverse cohort of patients with restricted tongue mobility. If you click on this video, you can see a video of a tongue tie in action. Tongue tie can lead to abnormal orofacial growth, which can create mouth breathing, local inflammation, tonsil enlargement, poor nasal breathing, etc. It can also lead to sleep issues and more. Now I will discuss oral myofunctional therapy. Myofunctional therapy is an individualized program of isometric or static and isotonic or dynamic strength and pattern retraining exercises of the tongue and orofacial muscles. Myofunctional therapy patients may be seen because of sleep, teeth grinding, breathing posture, orthodontic relapse, cervical neck tension, and or jaw pain issues. Myofunctional therapy is used to correct maladaptive oral habits and help restore ideal resting oral posture. It is also important to note that the frenulum beneath the tongue is a part of our fascia system. The fascia system is vastly connected through our body, and a restricted frenulum can lead to neck and back tension that oral myofunctional therapy can also help address. All in all, the goals of myofunctional therapy are to keep the lips together, the tongue up on the palate or the roof of the mouth, and encourage only nasal breathing. That way, myofunctional therapy can be used to correct maladaptive oral habits and help restore ideal resting oral posture. In this study, 420 patients ages 29 months to 79 years were treated with a combination of myofunctional therapy and lingual frenuloplasty for indications of mouth breathing, snoring, dental clenching, and or myofascial tension. All frenuloplasty procedures, or tongue tie procedures, were performed by a single surgeon, Dr. Sarush Zaghi, using scissors and suture technique. Safety and efficacy was assessed 2 months post-operatively by means of patient-reported outcome measures. It is also important to note that all patients received at least 1 month prior of myofunctional therapy and 2 months post-operative myofunctional therapy following their surgical treatment. As you can see in this diagram, the surgical scissors and suture technique requires advanced surgical skill, better visualization of anatomy, and thus leads to deeper releases of fascia and muscle, resulting in an eventual hairline scar beneath the tongue. Here's a brief diagram summarizing the results of our study. In this study, we have found that restricted tongue mobility was associated with difficulty breathing, eating issues, difficulty speaking, and muscle tension issues. Through intervention of myofunctional therapy combined with a lingual frenectomy using scissors and suture technique, 348 surveys were completed following this intervention that showed 91% satisfaction rate and 87% rate of improvement in quality of life through amelioration of mouth breathing, snoring, clenching, and or myofascial tension. Here are 4 tables outlining the results of our study. All in all, the results showed high rates of patient satisfaction and treatment success associated with low risk of minor complications. In Table 1, 91.1% of patients surveyed reported satisfaction with their lingual frenuloplasty and myofunctional therapy treatment protocol. In Table 2, 87.4% of patients reported improved quality of life after their treatment protocol. Table 3 outlines various benefits associated with the myofunctional therapy and lingual frenuloplasty protocol. These benefits include improved tongue mobility, reduced clenching or grinding of teeth, improved ability to perform myofunctional therapy exercises, improved ease of swallow, improved sleep quality, improved nasal breathing, decreased neck, shoulder, facial tension or pain, as well as decreased snoring. Table 4 outlines a few minor complications that are at very low risk. From these results, we were able to interpret that lingual frenuloplasty with myofunctional therapy protocol, as described in this manuscript, is a safe and potentially effective treatment for mouth breathing, snoring, clenching, and myofascial tension in appropriately selected patient candidates. Further research will help to better identify the most optimal candidates for this treatment. In these pre op and post operative photos, you can see a 7-year-old female pre op and post op following before and after her treatment. Before her treatment, this female exhibited mouth breathing, maxillofacial retrusion, and posture issues. Following this treatment, she experienced great reduction in these symptoms, as you can see in these photos here. I would like to say thank you to my research mentor and advisor, Dr. Sarush Sagi, as well as all of my coworkers at the Breathe Institute. I am so immensely grateful to be a part of this amazing team and learn more about this amazing research.